And secondly, we have I'm going to explain the basic operation of PHR, the personal health record in Catalonia. If I have time, I explain you pilot experience in Barcelona City to share information between health and social care centers. Okay. Catalonia is an autonomous community where live over 7 million people, where it's developing a national healthcare system and different services are requested to different providers. The system is decentralized system funded by taxes, decentralized to regional autonomies, universal coverage, free access, very wide range of publicly covered services. We have co-payment in pharmaceutical products and services provided mainly in public facilities. In this context, why we have developed AC3? AC3 is the shared medical record. Because we have a decentralized system with more than 160 different healthcare providers integrated into a single public network. Their care providers can select their information system. And fortunately, 90% of the primary care centers have the same information system, but is the opposite in the specialized care centers or hospitals, where we have a more heterogeneous information systems. In this context, interoperability must be granted. AC3 is a big platform where different healthcare providers publish the relevant information of each patient with the aim to sharing information between different healthcare providers and different care lines, and finally to improve the process care. Finally, the professional has a 360-degree perspective of the process and have all information integrated in a only screen. We have two sorts of information in AC3. We have information come from health centers, healthcare centers, and information from health department. The primary care centers publish diagnoses, healthcare reports, immunizations, chronic patient levels, progress notes, and outstanding visits. And specialized care centers, long-term care centers, and mental health centers publish discharge reports, emergency reports, specialized outpatients, clinic reports, outstanding visits, and other tests, image, radiologic image, and non-radiological image. And from the health department, we incorporate in AC3 all electronic prescription and anticipatory wills registry. We have connected almost all centers in Catalonia, public centers in Catalonia. We have now 168 public centers connected in AC3. And we have more than 150 million documents, structured documents and PDF documents published in AC3. The main goals are ongoing attention, faster, more flexible and more comfortable access to information and services, to increase the support to the activity of professionals, to generate more patient confidence regarding information security, and to avoid duplicity in the testing and greater control over incompatible treatments. Different healthcare centers are publishing an average of 30 million documents per year, and this year we have increased this publication by 47% about previous year. I will show you a short video to better understanding the AC3.
HC3, Shared Clinical Record of Catalonia, Networking Health. The HC3 Shared Clinical Record is an electronic medical record containing all key details on the health and progress of any patient being treated in the Catalan healthcare system. Almost 100% of Catalonia's public centres are now connected to the system. Acute hospitals, social health centres, mental health centres, primary care centres, emergency primary care centres. Recently, rehabilitation and dialysis centres were also connected. HC3 is constantly evolving and will shortly incorporate data from the social services and other areas. The health centres submit key healthcare information on patients via a number of services and systems. This information is recorded in HC3. Information is exchanged via interoperability mechanisms and the use of international standards between information systems. This makes clinical records from different health centres compatible with each other. Thus, HC3 facilitates and improves the task of professionals in different healthcare areas by enabling the shared use of patient information available amongst all the health centres in the network in Catalonia, 24 hours a day, 365 days a year. HC3 is the tool that gives our healthcare professionals access to key clinical information for every patient, so they have an all-round picture. HC3 provides support for the Catalan healthcare model. One of the basic objectives of HC3 is to ensure the continuity of healthcare, preventing the duplication of tests and the subjecting of patients to repeated examinations. With HC3, all professionals in Catalonia involved in the care of the patient have access to the shared information, which favours appropriate, quality healthcare. The tool helps make the Catalan health system more efficient in every sense. Time, quality of service, use of resources, data assessment, etc. HC3 gives professionals and patients greater confidence in aspects of security and confidentiality. The system guarantees the traceability of each entry to the system, and the information is transmitted securely and univocally. HC3 means greater health and improved quality of life in Catalonia. In the professional viewer, HC3 provides the following information. The heading contains the patient's details, marking as a patient with a complex chronic disease, PCC, and patient with an advanced chronic disease, MACA, and the individual and shared intervention plan, PIIC, which is assessed by clicking on the PCC or MACA icon. The clinical risk group, CRG, is also shown, classifying and predicting the patient's risk level. The tabs show which reports are available. It is also possible to consult diagnoses, medication plans, vaccines, data registered in the Catalan National Health System, the shared clinical course, which will be available shortly, and notification, where advanced directives are listed, and also, if necessary, information from the Directorate General for Child and Adolescent Care, DGAIA. The following can access the information contained in the HC3 records. Doctors, nurses, and other professionals working in diagnosis or treatment support services during the period the patient is receiving said service. The HC3 system is based on a proactive model involving professionals from a range of areas. Thanks to the collaboration of all health centres in the publication of data in HC3, Catalonia is improving healthcare and offers its professionals greater support. HC3 means increasing and sharing information. Health professionals can use two methods to look up information in the HC3. By using the professional viewer in the HC3 system itself, or by incorporating data from HC3 at clinical workstations in health centres, so that all information available in HC3 can be integrated directly in any health information system, highlighting that this information comes from HC3. This new integration function makes the system more usable and makes it easy to access all of a patient's details in just one click. With integrated HC3, information is more accessible. HC3 is constantly evolving. It is a dynamic working tool and new functions are constantly being added. At present, users can work with structured data, establish comparisons, and incorporate messaging and alerts according to the data published. All this means that HC3 currently has quality policies in place and the option to support the use of clinical indicators of information published or consulted. HC3, Networking Health. Ministry of Health.
5 minutes? Okay. This is, I don't have a lot of time. This is the new services we are incorporating after this video. I show you quickly. This is not radiological image that allow us to improve, to incorporate different care process of teledermatology in our different regions in Catalonia. This is outstanding visits integrated. Our centers are publishing our their visits in HC3, and after that, the citizen can see this information in PHR and can download this information in their Gmail and Outlook calendars. This is a preliminary report of emergency where the doctors in the ambulance can see this preliminary information to the HC3, and after this report get to the hospital before the patients. And these are different clinical variables where the citizen can enter in PHR, and this is go to the AC3, and after that, with different web services, the different healthcare provider can incorporate this information in their workstation and to have a different telemonitoring process in the visits. This is the progress notes. I haven't time to show you in a demo, but we are different providers. We have all progress notes of all centers, and you can select different centers, diagnoses, or specialties to have only the diagnosis for diabetes in all visits in the system, for example. PHR, 5 minutes. Is a personal safe digital online space where every citizen in Catalonia can check their health information and other services of the Department of Health. And it offers information published by centers, but it is in a simple repository. It's an independent module of AC3 with specific function exclusively for citizens. 3 main goals: to secure environment for citizens and to interact with health system providers and professionals. To promote responsibility and participation of citizens in the matters of their own health, and to improve health care quality between different care lines. We are evolving from a folder to a channel. The personal health folder, born in Catalonia in 2009, but we was only access with certificate digital, and we have only static information of AC3. But now, 1 year ago, we have incorporated the robust password to access in this personal health folder, and we are incorporate different services to communicate and to interact with the health department and with the professionals to improve the care process. This is any screen of personal health folder. We show the different entries of different professionals in my health report. This is the different entries in different centers. You can show, the citizen can show the clinical reports, diagnosis, vaccines with different reports, electronic prescription. This is a service that avoid a lot of visits of the primary care centers, because the people can print this information at home and go to the pharmacy to check the electronic prescription. And this is different services, for example, a consultation, where the citizen can put information and this generate a visit to a professional, and rapidly in 50 years out. I finish. Yes, okay. Thank you.